I'm going to now pass the baton to Sonny, who's going to go through the performance of the new 800. Sonny.
Thanks so much, Sean. That's a great introduction. And I've been thrilled with the new 800 laser as well, as I'm sure we all have. So what I want to talk about today is just the fast performance of the laser. If you look at Dan Reinstein's study that was published in 2023, looking at the speed of the laser, one of the reasons it's so fast is because the current VisuMax 500 has a 500 kilohertz repetition rate. The VisuMax 800 now has a 2,000 kilohertz repetition rate. And what that means is that you can create a SMILE lenticule, the time to create one goes from 30 seconds roughly to just under 10 seconds, which is really, really fast. And speed is great, but what does speed mean for us, right? So what speed means for us is that for a patient, it's less time under the laser, less anxiety, it's much more comfortable. For a surgeon, I know that I get nervous when I see a laser going across the eye. I kind of hold my breath sometimes, right? So having it happen in 10 seconds versus 30 seconds makes for a less stressful day for me. And then when you couple that with how fast it is and how you can get through patients more quickly, it means that we can finish our half-day surgical sessions more quickly. We don't bleed into lunch. My staff gets a lunch break to get out at the end of the day to get home to their families. So if you look at just efficiencies from that perspective, it really adds a great value to your practice. Right. And then if we look here, I have Dr. Doan going to create here his 9-second lenticule cut.
It's amazing.
You can see how fast it is. And that's it. Do we have any current SMILE surgeons in the room who use the 500? Yeah, so most of the time we're trying to get the patient to calm down, like, okay, I'm going to begin the laser, your vision's going to go white as you lose sight of the fixation light. You know, we're halfway through, give me 10 more seconds. And so this is over in 10 seconds, so it really is very quick. And here is going to be my lenticule cut, hopefully. Again, it's over in 9 seconds. More of a spherical cylindrical treatment. But really fast, and as we know, the VisuMax gets corneal suction, not scleral suction, so it's much more comfortable for a patient to undergo the procedure. Going back to Dan Reinstein's study, what they found is that there was a very low incidence of suction breaks, right? It was about 0.5% out of 4,000 eyes. With 65% of the suction breaks happening after 10 seconds. And if we're completing the new VisuMax 800 lenticule cut in under 10 seconds, we can expect a 65% reduction in suction breaks, which means that we're going to take the suction break rate from like 0.5% to roughly 0.15 or 0.2%. We didn't have any suction breaks. You guys have any suction breaks?
No.
You guys tried it? No, I didn't have any as well. So that's another safety feature of having a very fast laser. Looking at this slide, you can look at overall surgical time with the VisuMax 500 running at about 9.5 minutes, and then the VisuMax 800 about 7 minutes. And again, you're cutting out about 2.5 minutes per patient. And if I'm doing 10 patients in the morning and 10 patients in the afternoon, I'm saving 25 minutes of time, which is a lot of time. And for a lot of practices that are really trying to be uber efficient with their staffing and their processes and getting patients through the door, right, getting in, checking in, taking their medicines, getting retested, and getting in and out, their rides are waiting less, and there is just less time in the office for everybody. The docking time is also decreased from 194 seconds to 133 seconds. And the dissection time is also decreased. And one of the nice things about it is not only is the laser fast, but because the laser ablation profile is better, I found that I was getting, my dissections are much more easy, right? Would you guys find the same thing?
For sure.
Right? And which meant that there was less inflammation the next day, patients were more comfortable, and the end result visions were much better. We did not find any difference in uncorrected vision between the 500 and the 800, but you've got to take into account that the 800 is out of the box, right? And as we start to fine tune those results, I do expect to see some better results because we're using less energy on these patients. Here's another slide looking again at the differences between the VisuMax 800 and the 500. Again, the lenticule cut time is the big difference from 30 seconds to under 10 seconds. The dissection time is less, the docking time is less, and again, the overall surgical time, you're saving about 2.5 minutes per patient. That's all I have. Yeah. Any questions from the panel or from the group?
I think, yeah, Sonny, if you want to go back, I'm just curious, if you can go back to the to your lenticle dissection, the video. I just want to point something out.
I'm trying to get it to go back. Can you help me take it back?
Go back to the video. Yeah. This one will work. And just pause it, if you can just pause it. Yeah, you can just pause it there.
Oh, I didn't know how to pause it. Sorry. Let me start it here. If you guys can pause it at the table,
yeah,
it'd be
and you
great.
can just pause it right there. Anyways, you take note, and when you first look at this video, it looks like the ablation is decentered. And this would always be a time of anxiety with the 500, because you're thinking, am I putting this treatment on a decentered ablation on this pupil? Because you tend to think that it should be based on the pupil. What's nice about the VisuMax 800 is that's digitally aligned with what's called Oculine, which is taking information from the IOL Master 700 and determining that visual axis, and then allowing us to make sure we're putting that treatment right on that visual axis. And when I saw these two videos, at first look, if you're on a 500, you might be like, I think I'm visual axis. I think that maybe there's angle kappa. It's probably fine. And now you know it's fine. And that confidence it gives you is amazing. I know you're probably going to go into that.
Yeah, that's a great segue to Audrey.
Yeah.
Absolutely. Thank you so much. Yeah. Also, just in terms of, decreasing both your anxiety as well as the patient anxiety, almost anyone could do anything for 9 seconds.
Right.
Okay, when you say it's less than 10 seconds, then I think that there's already that, that relief for both the patient as well as the surgeon. But patients, then it's a lot less anxiety producing as well.